Hello, my name's Kevin. I'm a first-year emergency medicine resident training at UBC at the Interior site. Today we're going to be talking about ultrasound to assist in landmarking for lumbar puncture. So why use ultrasound for lumbar puncture? It's certainly not required, especially in patients who are easily externally landmarked. But for some patients, especially those with a higher BMI, it has been shown to increase first pass success. So you can start by positioning the patient as you normally would. They can either be sitting up or lying on their side. You can use two different probes. You'll either use the linear probe or the curvilinear probe. The curvilinear probe does allow you to visualize deeper structures, which may be preferable in patients with a higher BMI. You can start by landmarking as you normally would. Use the level of the posterior superior iliac spines, which should be approximately the level of L4. You'll now place the probe in a transverse orientation with the goal of identifying midline. So on the screen, you'll see the spinous process come out quite prominently with a shadow behind. You can actually confirm your level here as well. So you can start inferiorly, find the first spinous process, which would be L5, and then work your way up from there. So here you can see the spinous process with the shadowing behind. So you'll center your probe on the spinous process, and then you'll use your surgical pen to mark the patient for midline. We'll now switch the orientation of our probe longitudinally with the goal of identifying the intervertebral space. You can see the space between the two spinous processes. So you'll center your probe on the midline of the intervertebral space, and then you can mark the patient. You can do this at a couple levels if you want options. And now you have X marks the spot for your best chance at success. Additionally, you can use ultrasound to assess for depth to the canal. You'll start with the probe again in longitudinal orientation and centered over the spinous processes. You'll then move the probe laterally until the transverse processes come into view. It should look like a sawtooth appearance. And you'll measure from the surface down to the base of that sawtooth pattern, which should be approximately the level of the canal. And now you can proceed with your aseptic technique as per usual. Here are the references. Thank you for watching the video, and hopefully this helps you with your next difficult to landmark LP.